It's time for Medical Monday, and as always, nice to reconnect with Dr. Dylan Joseph, our first chat for 2022. Dr. Joseph, how's it going?
Eon, very well, thank you. Good to be back in the office today after a great break over December. Pity about some of the weather.
Yeah.
That's the Southern Cape for you, isn't it? 4 seasons in one day.
Yeah, so. I said the other day, we're actually having the December weather now. It's a month late.
Exactly, albeit brief. I mean, yes. We had 2 days of serious heat, and it seems to have clouded over again.
Yeah, it's cooling down a bit. Yeah,
well, I suppose that's the beauty in it anyway.
It is
the mix-up.
It is. And then we're starting 2022 with some good news. I mean, we spoke about it in December before we went on our break. Some exciting news that you have to share.
Yeah, absolutely. You did chat briefly to Beata. She's a refractive optometrist that is going to be heading up a screening center for us in George Central. And we've sent out some recent communication, and there seems to be a little bit of confusion amongst our readers on our adverts that we send out. And they thought actually that we were moving our entire operation through to George, which just for the record and to clear that up is an absolute no. We're completely based in Knysna. I will be 100% at my office in Knysna. What George is going to do is it's going to work as a screening center for the main office. Now, we're getting more and more patients from Stilbaai, from Oudtshoorn, George, Mossel Bay, Dana Bay, that are looking for refractive solutions. And part of the reason for opening the screening center is to make that journey shorter for these patients. The whole screening process is quite involved. It's intricate. It involves dilating the eyes to have a good look at the back of the eyes. And for that reason, we can't do surgery on the same day, or we can't actually do it the next day or the day after. It usually takes 2 or 3 days for those pupils to get back down to normal size, and that's really important for the laser to pick up the pupil capturing. So if the patient was driving through from Stilbaai or from Mossel Bay or from George, they'd often have to come in on the Friday, and then the earliest day they could have surgery would be the next Wednesday. So it's a lot of back and forth, or they'd have to make a long weekend of it. So what we're trying to do in the best interests of our patients and to help these patients that do travel from far is to say, right, well, now get yourself to George. You can be fully screened on exactly the same technology, the same equipment. Our practice integration is all digital, so I can see real-time all the data that gets uploaded onto the system in George, and we can make real-time decisions for these patients. So literally, without me seeing them in George, I can tell those patients that they're a good candidate for example, a LASIK procedure, a PRK procedure, or an advanced surface ablation procedure. They go back home, they get their date, and they come in for the day of surgery in Knysna. Now, the important thing to remember there is that, you will always see me on the day of surgery too. So I will repeat your vision. I will have a good chat to you, a thorough examination of your eyes, confirm findings, and we can then go ahead with the surgery. And you can either go back home, or you're staying in Knysna for one night then instead of 2 or 3. So it's just about trying to make the service offering more available and more convenient to our far-reaching patients.
That's very, very convenient. I like that, Dr. Joseph. So all the basic screening services, and then also let's talk about dry eye and the importance of it when it comes to vision correction surgery.
Yeah. So, just in summary there again, Eon, those services that we'll offer there in George would be the LASIK screening. We'll talk about it a little more in detail because this is a really big focus, will be the myopia control or short-sightedness control. Dry eye is another one of the major services. I think, it's often overlooked as we talked about in one of our early podcasts last year. Dry eye is it's so overlooked and so underdiagnosed, and the symptoms are so variable, and it's so important in refractive surgery. The analogy that I always use with my patients is try driving your car in the rain when your windscreen wiper blades aren't working. Now, why that's so important is because if your eyes are dry, most of the symptoms are irritation and foreign body sensation and redness and discomfort, and you wake up with, crusting of the eyelids in the morning. But a big symptom that's overlooked is the fact that you get fluctuating vision. And that's the whole analogy that's tied into the windscreen wipers in the car. If your windscreen wiper blades aren't working, you're not going to see where you're driving. And it's the same with dry eyes, and it's the same with refractive surgery. We know that one of the risks of refractive surgery, be it laser vision correction or cataract surgery, albeit transient, is a drying of the surface of the eye. And we can treat that post-operatively, but the dictum, prevention is better than cure. So picking up on dry eye disease and the signs and the symptoms and treating this is as important as the surgery and the outcomes itself. If we don't do this properly, we're going to have suboptimal outcomes, and we're going to be treating these patients for a lot longer than necessary. So part of our dry eye screening protocol there is understanding your visual symptoms, understanding your complaints. We put you through a number of seriously integrated diagnostic equipment, which we also have in Knysna. So the point is, there is no difference in terms of the dry eye screening process that you'll go through in the George Screening Center as opposed to what you will go through in Knysna. And before even deciding on cataract surgery or laser surgery, especially for the traveling patients. So imagine you've come all the way from Still Bay, you're really keen on having your surgery, you've gone through from the Dexter Drive, George to Knysna and back, and I tell you, you've got dry eye and we've got to postpone your surgery for another 2 or 3 weeks while we optimize the surface of your eye. Here, with the screening center, we can pick up these problems. If you're looking for surgery, treat them first, and then you go back to the George Center, have a chat with our refractive optometrist again, make sure that that's optimized, that your tear film's in good order, and then we can take the next step to considering refractive surgery. So I think absolutely it's a quite a novel idea. There's a dedicated dry eye clinic, but it ties in very, very well with the concept of refractive surgery, which can be either corneal-based or lens-based in terms of cataracts or refractive lens exchanges. So very important to make sure we're on top of that, and that's why we're opening up that service as well in George.
And then, Dr. Joseph, you also mentioned the new methods of treating children with short-sightedness. That sounds very interesting.
Yeah, it's a massively expanding space, and if you listen to the podcast, a couple of weeks ago that you did with Beata, we know that myopia, and we've discussed what myopia is, it's short-sightedness. It's an epidemic. It's a global epidemic. By 2050, half the world's population, which is 5 billion people, are going to be short-sighted.
Wow.
And the large component of this, other than genetics, is the fact that from a very young age, we're spending too much time in front of devices, in front of laptops, PCs, computers, we're reading. We're all educating ourselves, but at the end of the day, we're actually doing our eyes a disservice because we're constantly putting our muscles in the eyes under strain. And what this does is it causes elongation of the eye. So when you get abnormal elongation or lengthening of the eye in proportion to your age, it's disproportionate to what the growth should be for that age. So when your eye is longer than normal, the light rays fall short of the back of the eye, which makes you short-sighted. So essentially then the typical method of treatment is to go into glasses when you're young and then perhaps contact lenses as you get older. We know, however, that when you're wearing glasses and contact lenses, there is peripheral drive or stimulus to keep the eye lengthening. Not only that, but we don't educate our patients enough about spending more downtime off the computers, off the laptops, the PCs, the phones. That's been shown in studies that just 1 hour a day reduces the progression of myopia significantly. But there are new technologies available today, very fancy types of contact lenses in young children and teenagers that we can fit, which basically cause blur in the what we call the periphery or the outside of your vision. So what happens, the connection between the brain and the eye, it's so intricate that this edge blur, which you don't see but the brain perceives, it has a way of slowing down the lengthening of the eye by wearing these contact lenses. So you take a child who is maybe presents to us for the first time in our screening center at -1. By the time they're 18, if this wasn't treated, they may be a -7. And the problem with going from -1 to -7 is not the fact that you every year renewing contact lenses and spectacles, but there is a significant increase in the pathology or the morbidity associated with increasing degrees of myopia. So risks of retinal detachments, retinal tears, so the light-sensitive membrane at the back of the eye coming loose, risk of the jelly inside the eye detaching from the back of the eye prematurely, so you get flashing lights and floaters, and risks of early cataract formation. So not only is this going to be a burden on the person, because studies have further shown that as your myopia progresses, so your productivity decreases too. But this is going to become a major burden on our medical aides, because these myopes are going to develop significant pathology which are going to require surgical intervention at some stage, potentially in their life, which could have been halted at an early age. Well, these contact lenses are the one method. We've got another contact lens approach called Ortho Keratology, which is it's a hard contact lens that you wear while you're sleeping, and it compresses the front of the eye, which corrects the short-sightedness or the myopia while you're sleeping. And then during the day, you take this lens out.
Wow.
So you actually contact lens free during the day. In conjunction with this or alone, we can use a drop called atropine, which actually relaxes that what we call the ciliary body, which is the muscle that controls your vision for near and for far. So those factors, in conjunction with perhaps getting patients to spend more time outside, less time on the computers, help us to control the progression of the myopia. And then, of course, once you enter this program, once you enter the myopia control clinic, we take you through those stages of through childhood to adolescence, and we can document all of that for you. And then by the time you reach 18, which is considered ocular maturity, we can then say to you, right, you've been educated through the last 10 years of your myopia. Now you're at a place in your life where you can make a fully informed decision of, do you want to continue with contacts, spectacles? And right in the other point of this triangle is vision correction, which can be in the form of laser vision correction. It can be in the form of implantable contact lenses. But what we need to do as refractive surgeons, as optometrists, is empower our patients to know that there are options available. And when they reach ocular maturity, they have that power to say, right, okay, well, which road for me do I now explore? And that's part of our clinical drive. Our focus and our motto is, Vision for Life clinics, own your vision. So we're wanting to give patients those opportunities. Refractive surgery is nowadays as safe as flying. So if you look at a very interesting analogy I heard last night, flying in the United States in the 1960s, there were about 2 million or 3 billion air travel hours. And there were 465 deaths associated with commercial flying. Between 2015 and 19, we had 3 trillion commercial flying hours and not one associated commercial death with flying. So the narrative has to change, that laser vision correction or vision correction is nowadays as safe as flying.
Yeah.
And it's about empowering our patients to make that choice, to take that decision to say, wow, I'm now 18, I've gone through this program, I've been closely followed, people care about my vision and vision correction and slowing down my myopia, which is the biggest thing, so that I don't develop future problems. What are my next steps that I can take to correct my vision?
And that's it for Medical Monday for today. Dr. Joseph, your centre in George is already open and operational, right?
So we're busy getting kitted out, Eon. It's in the final stages of getting its fitting, and then it's the software upgrades and the links between the two practices. So we should be up and running by early next week, mid next week, and then we have our welcoming function and opening function for our colleagues and industry members on Monday the 24th. Very, very exciting times.
Very, very exciting. What a start to 2022. Going in with a bang.
Yeah, thank you.
And congratulations.
Absolutely.
It's nice. It's so great to expand. Well done.
Thank you. Looking forward to it. So, we can, you can reach the clinic directly through our website. They're at 76 York Street, Harvil House, George Central. Harvil House is a lovely new complex. There's a great little coffee shop there, Poker Loca, that you can sit and enjoy a coffee while you're waiting for your dilated exam. And Beata Parsons is our refractive optometrist, and Alana de Kooker is our front of house patient liaison officer. They'll be happy to take your questions. So the email address there is vlcgeorge@drdillanjoseph.com. And we've got the social media icons are exactly the same as my office in Knysna.
Great. Dr. Joseph, thank you so much, and wishing you a wonderful week. I know it's going to be a busy one.
Thanks very much, Eon. Looking forward to it.
Just the contact details again for the Vision for Life Clinic in George by Dr. Dylan Joseph. The address is 76 York Street, Harvil House in George Central. And the telephone number 044 15 00 160. That's 044 15 00 160. Email vlcgeorge@drdillanjoseph.com and the website drdillanjoseph.com.